If you're starting to feel the holiday stress, I have got the answer for you. So our Rest and Relax oil by Radical Roots is hands down our bestseller, and it is so for good reason. This formula is so safe, effective, and versatile. Everybody loves it. So what we did is we combined full spectrum, high quality hemp with a Chinese herbal formula that nourishes the heart and calms the spirit. So it's great to take during the day if you're feeling any sort of anxiety or stress, but it's also awesome to take at night if you're looking to make sure that you're getting the highest quality sleep that you can. I take it almost every day, and I'm certainly taking it any time that I'm recording a podcast. Head to radicalrootsherbs.com, use the code HOLIDAY30 and get 30% off of our Rest and Relax tincture through New Year's. Hey guys, it's Dr. Chloe, and you're listening to the Radical Remedy Podcast. Today's guest is Dr. Thomas Leung. He is not only a pharmacist, but a doctor of Chinese medicine as well, and the CEO of Camwo Herbs. If you have never been there before, Camwo is an absolute institution in New York City, Chinatown. They've been around for 50 years, educating the public on the power of Chinese herbal medicine and filling herbal formulas for practitioners all over the country. I love Dr. Leung's unique approach to Chinese medicine. He's incredibly down to earth and has a great respect for both Western and Eastern medicine. And I found this conversation to be so helpful. And we dispelled a ton of myths around Chinese herbal medicine, and really, hopefully, will help you understand more deeply why I love this medicine so much. So please check it out. Let me know what you think. Make sure to go over to camwoherbs.com and find out more about what they do. It's really, really incredible, and I'm so grateful that Dr. Leung was able to share his time with us. I hope you guys enjoyed the episode. Please remember to like, follow, share. It means the world to me. All right, guys. Today I'm here with Dr. Thomas Leung, the CEO of Camwo Herbs in New York. Camwo is an absolute institution when it comes to Chinese herbal medicine. They've been around for 50 years, and it is truly an honor to have you here to speak with me today. Thank you so much for joining me, Tom.
Hello, Chloe. Thank you for having me. Pleasure to be here with you.
So I know that your father founded Camwo, but when was it that you really decided that you wanted to follow in his footsteps, or was that just a given from the start?
I get this question a lot, and I grew up in the business. I think after I graduated college in 1992, I worked a few years as a pharmacist. I went to school in the University of Buffalo. I came back to the business, and I started working there full time in 1994, and I'm here ever since. Pretty much been here all my life.
I love that you have the dual background of the Western pharmacology. Also, I've always felt like Chinese herbal medicine is such an incredible way to help bring Chinese medicine to Westerners or people who are less comfortable with Chinese medicine as a whole, because we can look at the Western pharmacological actions of the herbs as well as the Eastern energetics of them. How would you sort of describe some of its core principles and how we look at herbs as opposed to how Western medicine looks at pharmaceuticals?
Chinese medicine is about balancing the yin and yang of the organ systems and to maintain health. I mean, in a nutshell, that's what it really is. So, and people oftentimes attribute that, or they would say, oh, this is very good for preventative medicine. And it is. It's one of our strong points, but that's not exclusive. We also treat acute management as well. Acute conditions. We manage acute conditions as well. In Western medicine, our strong point is to treat acute conditions. We treat that very well in Western medicine. Preventative medicine, we're okay. We're pretty good. But in terms of maintaining health in Western medicine, we're really lacking, comparatively speaking, with Chinese medicine. And, to your point about earlier about me being a Western pharmacist and having Western pharmacology knowledge and also Chinese medicine knowledge, the funny thing is in other parts of the world, like in China, Japan, Korea, medicine is medicine. And they choose what's best for the individual condition, individual presentation. And there's less of a delineation between Western medicine and Chinese medicine. And that's something I wish that in the United States, in the West, that we are, I guess, moving toward that trend. That would be, I think, would be very helpful for everyone, public health.
Yeah, it's interesting seeing the changes in our society as we're bringing Chinese medicine into hospitals and different Western medical systems. I know when I studied for a month in Heilongjiang University in Harbin, and it was amazing getting to see acupuncture with pharmaceuticals, with Chinese herbs, and exactly as you said, whatever the patient needed and however the patient was going to be best served. And I always think that that's the best way to do it. You know, Western medicine certainly has tremendous value in so many ways, but Chinese medicine, as you said, is really powerful in terms of preventing health, restoring health. And one of the things I've been obsessed with recently, my sort of catchphrase has been, you know, I think it's time that we start building health with Chinese medicine as opposed to responding to disease, which is typically what we're doing with pharmaceuticals. So if we can sort of get that hand in hand where people are actually fostering health with herbal medicine, acupuncture, lifestyle, and the wisdom of traditional medicines, then when we're getting sick or have acute diseases, you know, pharmaceuticals and Chinese herbs can also be really phenomenal to respond to them. But
Agreed, absolutely.
So one of the things that I always have a hard time describing, so now I'm going to put it on you. I would love to talk about, so in Chinese herbs, we look at the herbs as in sort of different groupings. So in different categories and how we look at them. How do you typically describe that to somebody who's coming into Camo and looking for some information on how Chinese herbs work? So why do we have herbs for phlegm or versus, you know, how do we use herbs? Or if you want to break it down, maybe first doing acute versus chronic herbs, whatever sort of seems like a best starting point.
So there are gatekeepers, the practitioners themselves. So people don't just come in and say, hey, I have this condition. Give me some herbs that transform phlegm, or give me some herbs that do X and Y and Z. For most part, and there are exceptions, of course, for most part, people would see a practitioner because unlike Western herbology, it's not like this herb is good for this condition and this herb is good for that condition. So, well, therefore, I can use it. As you know as well as anyone, being a Chinese medicine practitioner is all about patterns, right? And people may have the same cough, but they show different patterns. We have to distinguish what patterns they have, and then we have the appropriate formulations. So, and I think that oftentimes your regular Chinese medicine patient are educated. At least in Asia, they are. Here in the United States, maybe less so, but it's not something that they would come in and just say, "Hey, give me this herb. What herb is good for transforming phlegm, and what herb is good for that?" To them, it's, you know, it really shouldn't be about that. It's really, you need to see a practitioner who would then give you formulations. And of course, there are exceptions, right? So it's not across the board, but most part, that's how that, at least in our setting, retail setting, that's how it works.
Yeah. I guess what I'm getting at is more, I get a lot of people who ask, you know, and people constantly ask me to come up with formulas and just say, you know, I have radical roots. So we have patent formulas that are pretty safe for people to take off the shelf. I formulated them that way so that they were more accessible to people to get a taste of Chinese herbal medicine without having to go to a practitioner. Again, I will always advocate that custom herbal formulations and working with a practitioner is something that everybody should be doing. But what I get all the time is people saying, well, what do I do for thyroid disease? What do I do? What's your favorite herb for allergies or what? So why is it that we sort of use Chinese herbs in well, let's start with what are pattern differentiations? When you talk about that, like what are the patterns in Chinese medicine? What does that mean?
Yeah, so in Chinese medicine, we assign different patterns for different conditions. So, you know, a headache, for example, this is a very common. Now, in the West, in Western medicine, if you have a headache, for most part, of course, there's exceptions. Gotta lawyer up a little bit here, just because there's exceptions here and there. You know, for most part, and I'll tell you, as a pharmacist, if someone has a headache and it doesn't seem like one of those, like, you know, acute situations, sure, you can take an ibuprofen, like Advil, naproxen, one of those NSAIDs, right? That's the anti-inflammatory drugs, the aspirin family, and they'll be fine. In Chinese medicine, it's really not like that. We need to know why, what's the underlying cause that causes headache. Because in Chinese medicine, pretty much we cannot treat you unless we know what the pattern is. And back to the very beginning of this podcast, when I was describing how does Chinese medicine work, we balance the yin and the yang in different organ systems. And when that balance is off, it could present in a certain pattern and result in a certain condition or symptoms. In this case, would be a headache. So one common one for a headache could be from, let's just say, liver qi stagnation, right? Where people get stressful. And that's one way to treat the headache, as opposed to another type of headache where maybe blood stagnation, where the blood's not flowing very well. That could also be a different type of headache. The presentation can be often different, right? The signs, the symptoms may vary a little bit. So, so patterns is what we need. Oftentimes, we need to know what the patterns are. So it's always very hard to treat. That's why a lot of the over-the-counter formulations that are with herbal medicine is very hit and miss, because if you hit the right pattern, it works amazing. If you don't hit the right pattern, that doesn't do a thing. So that's why the Chinese medicine, to reinforce, just tie everything up, it's a very individualized medicine, and the value of the practitioner is very important. Yeah.
Absolutely. And one of the things I always love talking about whenever I'm on podcasts is I reinforce how much education we actually have as Chinese medical practitioners.
Absolutely.
Because so many people think that it's, a 6-month certificate program. It is just to get your master's degree. So to be a licensed acupuncturist, master's of Chinese medicine, you do 3 years of 8 classes a semester, 3 semesters a year minimum, not to mention passing multiple different boards. And then to get the doctorate, there are different levels of doctorate, but then you're doing additional training on top of that. So it's just for the master's, it's a course equivalent, I believe, of 4.5 master's degrees in 3 years or 2 law degrees. So I just love hammering that one home because it really is
quite absolutely. In February, I'll be giving a talk. It says I'm also a Western pharmacist. So the New York State Association of Pharmacists, they invited me to give a talk about Chinese medicine. When I spoke to the organizer, the amount of schooling that a Chinese medicine practitioner has to go through, their mind is completely blown. They would never thought that, one, it would be that many years. Like you said earlier, master's degree. There's also a doctorate degree. So we're looking at 4 to 6 years on top of your undergrad.
Yeah.
Right? So there's an undergrad that's not even factored in. So if you go through the whole track, it's very rigorous. So you're not graduating until your late 20s, assuming that you're coming to Chinese medicine school right after college. So it's very rigorous, and people are very well educated for that. Yeah.
Yeah, it's I know I sort of stumbled into it, and I think I have one of my teachers, Michael Leung, would always say it's really a calling, and if it's not a calling, you won't stay in the field. And it's one of those things for me. I can say, it's one of the greatest honors of my life. I could not be more obsessed with Chinese herbal medicine and the power that it holds. So I'm just really grateful that I sort of fell into it, and I'm really excited to do what I can to try and help spread awareness. One of the things that you do with Camwell is you guys do a lot of education for the public. Do you guys, I know I've seen videos or pictures of you guys on social media with a bunch of kiddos in the store. How do you see Chinese medicine working with kids? How does that sort of play out for you? What kind of questions are they coming in with that you might be able to share with us?
Yeah, so that's something that we love to do. And we just love doing that, especially the elementary school tours, which we get a ton of in the tri-state area. And they usually come around between April to June, when they have the field trips when it's warmer. And so we have these second grade, third grade, fourth grade, fifth grade, all grades. But the younger ones are really fun. They come in and they have no idea. They have no biases, right? Like they just come in and they are very receptive. They're empty slate, just open-minded about, there's no prejudice about anything. And they're so receptive to that. And we love it. And we basically tell them, in kiddie terms, what Chinese medicine does and how we differ from like a Rite Aid or a CVS, and the similarities and things like that. And they're very receptive. And then the reason we do this is we want the next generation to be aware of what Chinese medicine is not as mysterious, and break a lot of the myths surrounding Chinese medicine. Because people have these preconceived ideas what Chinese medicine is, and they're very inaccurate. And so when they meet someone like me or my colleagues who do the tours, not so much the children. Again, the children don't really have much of an idea what Chinese medicine is supposed to be. But you can see the chaperones, the teachers, their mind get blown all the time. And I really love that. And it's not just elementary school students. We also have high school students. We have colleges that come in, regulars like King University. We just recently hosted Pace University. That's a medical botany class. We have medical colleges, because oftentimes one of their class requirements is to learn about alternative medicine. So they oftentimes choose us. So we give them a talk. Nursing programs, their classes come in. And that's not even talking about the Chinese medicine schools that come in and do the tour. So we do this all the time, and just to educate them about just some of the things that we're just talking about now in the podcast. And one of my favorite tidbits, I just want you to know, Chloe, and I think you will appreciate that, and this always mind blow people, is when I tell them about Chinese medicine, I said, do you know that who the practitioners of Chinese medicine, who they are? And there was because they have this stereotype, especially the older folks, adults, they have this stereotype, some old guy behind a beaded curtain, right? They have this stereotype. And I tell them, do you know that the majority of practitioners of Chinese medicine are not even Asian? The statistics is 60% of Chinese medicine practitioners are white. Only 20% are Asians. That includes South Asians. And the balance of that are Latinos, Jewish people, Blacks, just whatever the demographics is of our country, right? So, and people just get mind blown, they're like, wow, 80% of TCM practitioners or Chinese medicine practitioners are not even Asian. So it is, and listen, Chloe, you've been around at Pacific College, at most of our colleagues, majority of them are not Asians. I mean, look at yourself, look at there's other people you know. So that's one of the message I want to bring out there, let people know this medicine is not exclusive to Asians, So.
Yeah, well, I remember when I studied in China, I remember some of my friends that I made from the course, from the university out there, they were blown away that so many, it was mainly white girls from Boulder, Colorado, were going out there to study Chinese medicine, and were so passionate about it. And they were like, why aren't you studying Western medicine, And we were like, this is incredible. We're all in on Chinese medicine. But it is fascinating to see. I think a lot of practitioners, from what I see, and you can correct me or, let me know what your experience has been since you've been teaching for quite a long time also, is a lot of people who find Chinese medicine, become practitioners of Chinese medicine, do so because they have really challenging health conditions that they have then somehow found Chinese medicine for, and then Chinese medicine has dramatically changed their life, and then they become incredibly passionate about then passing that on to as many people as they can. So it really is a labor of love. And then another thing that I also like to point out to people is there's really very few places that you can get a job as an acupuncturist or as a Chinese medicine practitioner. So it's always hard for me when I look at other practitioners. So many people get out and they have to start a business. So if you are working with a practitioner of Chinese medicine, that person has not only trained as, a doctor or a practitioner of Chinese medicine, but they've also gone through all the challenging hoops of learning how to successfully run a business in order to provide this medicine for you, which are really not overlapping skills. Some of us quite enjoy it. I think both of us are included in that very, very small minority. But most practitioners really have to fight kind of tooth and nail to get through the schooling and then to also provide the medicine for people.
Oh, so absolutely. You hit the nail on the head. So in China, if you were a Western medicine doctor, a Western MD, you also study some Chinese medicine. Not a lot, some. So to them, even, so they have a working knowledge of Chinese medicine. What I wanted to say about that is in the programs in China, the four big hospitals, universities, Chinese medicine universities, they have foreign programs. People from all over the world come and study there, and they're taught in English like you were. So people from Spain, Italy, France, whatever, they all are. So it's really worldwide. So that's number one. And to your point about the starting your own business, yeah, and it used to be a lot more of that. There weren't that many jobs. It's more now because now, especially in the big cities, most hospitals now have a department of acupuncture. Maybe 20, 30 years ago, not the case. But now, I can't imagine the hospital not having a department of acupuncture. So that's there. And then there are more places now for graduates to get a job. So there's more. So it's a little bit better. But yeah, you're right. Back in the day when we were graduating, you pretty much have to set up your own office. And not everyone is, I would say, their personalities lend to be successful in that environment. But so it is very challenging, So the environment's a little bit different. But yeah, oftentimes private practice does constitute a big part of our profession.
Yeah, it's interesting to see the different paths that there are within there. And anybody who's listening, if you fall in love with Chinese medicine, I could not pick a better career, although I haven't seen patients in a minute, but I still love it so much. So why don't we go through what is sort of like a typical intake for somebody coming in to see a Chinese medicine doctor for the first time? How does that kind of look?
Well, the intake, it's really not that different from a Western medicine intake, I would say. I mean, as of course, that the diagnostic with us is a little bit different, right? Because I would say it's a lot different. Maybe it's not a little bit different. Of course, there's similarities, but but we would feel your pulse. That's one of the diagnostics that we have. The pulse tells us a lot of quality. Now, in the old days, Western medicine, allopathic medicine, we do pulse taking a lot. But with with now more modern diagnostics, they kind of, that skill set has fallen by the wayside. It's not emphasized as much. I can't even remember going to a primary doctor to have a feel my pulse. I EMT all the time, right? Because you get a lot of important information. So we still retain that. Another thing that we oftentimes ask, and Chinese medicine practitioners, we need to look at your tongue. I think your tongue can tell you a lot about your constitution. Again, in the old days, I would say, I don't know, maybe last century, a Western physician would look at your tongue too as well. So we still retain that. It tells us a lot of information. And then looking at your tongue, feeling your pulse, looking at your complexion, asking about your extensive GI history with stool, your urine, the quality of your urine. All these things will build up an important picture that lets us know what pattern you have. So it may seem a little weird for people to say, why are you looking at my tongue? And why is my complexion so important to you? Well, these are important pieces of information that necessary in by themselves. They don't really tell us everything, but it helps build the big picture. And then that plus the questions that we were asked about your condition will give us a very good idea what pattern it is, or there's something that would be a right fit for Chinese medicine, or it's not a right fit for Chinese medicine. I think that is as important. As you know, going through the Chinese medicine programs, all Chinese medicine programs, knowing triage is important. So, okay, something that we treat, something that we can't treat, something that requires immediate medical intervention. So I always emphasize that Chinese medicine practitioners are not ignorant to those things. We do that. We see something that requires it, we definitely will refer out right away. So, it's very roundabout answering that question. Isn't that too long?
No, it's great. I think it's always funny when people, if you say you're a Chinese medicine practitioner. I was just at the dog park with my puppy, and somebody was like, do you look at people's tongues? And they you could see them doing everything they can not to stick out their tongue at you. And you're like, I mean, I don't care. I can tell you very quickly what your tongue tells. But it is an entertaining facet that I think a lot of people find very amazing. But yeah, I think it's always amazing to me to see the many different layers of how people present and all the different signs and symptoms that their bodies are giving us without having to do complex diagnosis, which it's phenomenal to have these complex things. I always think of my son, Remy. He's got that rare genetic disorder that causes intractable epilepsy and cognitive disabilities and Parkinsonian-like tremors, all sorts of stuff, right? And it took 2.5 years before the genetic condition was actually diagnosed because it's so very rare. We had to do whole exome testing. And so as a practitioner of Chinese medicine, I was treating him for phlegm, misting the mind, and a wind disorder, essentially. And so it was entertaining when I got the diagnosis for his rare genetic disorder. I was like, nothing about this genetic disorder changes how I'm treating my child from a Chinese medicine perspective. So it's wonderful to have those Western tests and diagnostics, and they're really, really cool and interesting, but it is always mind-blowing to me to see how Chinese medicine, the framework of Chinese medicine and the way that we're able to view the body and its mechanics and its ability to function are still very valid, and we can use that in any circumstance. I always say you don't need a Western diagnosis to see a Chinese medicine practitioner. We can really look and see what's going on underneath in a really profound way.
Absolutely. And also another thing that I want to emphasize is that Chinese medicine practitioners, we're primarily, most of us are, I would say, your a GP, your general practice. Just like your primary general practitioner, they don't make all the calls, meaning that they would send you out for diagnostics. So they would read what the radiologists would say on an MRI or on an X-ray, all these things. You know what? And that's something that we also do. They do that in China. We also do that too. So when we talk about this in class all the time, if someone presents with an immobile mass in their abdomen, one of the things you do, you refer out, get the sonogram, get the MRI, find out what it is before you start treating them, right? So we are not, so we don't have blinders on. We say, we only do palpation, do tongues, and feel people's pulses. No, like your GP, like any we refer out. We read diagnostics. We may treat the same way, or we may choose not to treat the presentation if the condition is not a good fit for Chinese medicine, right? So that's something that I always preach in class. We do not need to treat everything under the sun. There are some conditions in Chinese medicine we are very good at, and there's some certain conditions that I would not treat with Chinese medicine. Case in point, you get hit by a car. You're not getting treated by Chinese medicine, at least not right away, right? Yeah, if you think you're going to have a stroke, obviously that's acute intervention, right? So you wouldn't go to your GP when you have a stroke. No, you should be going to the emergency room. So there, we have to be practical about, and we as Chinese medicine practitioners are educated on these conditions as well. We know when to treat, when not to treat, when is a good option for us, as this is a good option for Chinese medicine, and when it is not. So it's, and I tell, and I want to tell the public about this, because sometimes people have this idea that it's either Chinese medicine or Western medicine. I hear that all the time. And the reality is that's not the case. People come here, see Chinese medicine practitioners, also use Western medicine, but they choose what's best for them, depending on the presentation. So that's something that I think that it's realistic. And I think it's right. That's the proper way to handle your health.
I agree with that. I always tell my patients, start with diet and lifestyle and, hone that in. Are you sleeping? Are you actually moving? What are you eating? Let's start with the bare basics, because how many people in our society are actually doing those bare basics correctly, and many practitioners are at fault of that also. So I'm not saying I or anybody else is perfect, but start with that. And then, energy work, acupuncture, moxibustion, herbs, but pharmaceuticals or, like Western interventions are totally options in there also. And I think it's important to look at all of the options, look at where you are in your disease state, in your mental health state. I often will have patients with, very severe anxiety or depression. And if they need an acute intervention for a little while they're working on building up, healthy habits to build health and resilience, that can be really a game changer for a lot of people. So I think we don't want to throw out the baby with the bathwater when it comes to any medical option. So what are some of the misconceptions that commonly walk through your door when it comes to Chinese medicine? I know that I constantly get asked about rhinos' horns and all sorts of animals, which we do use some animals in our herbal medicine, but I'd love to hear you speak about some of those myths. If you're here listening to my podcast, I'm sure you've picked up on one very important thing about me, and that is that I am completely obsessed with Chinese herbal medicine. Truly, it blows me away day after day, 15 years in, at how safe, effective, and powerful these herbs can be. And while I could not be more proud of Radical Roots and all of the herbs that we offer, the gold standard in Chinese medicine is truly custom herbal formulations. And so I'm so excited that I'm starting to open my books back up to see a few new patients. So if you are interested in getting a custom herbal formula by me directly for you and working one-on-one with me, email me at chloe@radicalrootsherbs.com and I'll get you set up so we can get you feeling your best for the new year.
I teach herbs at herbology at the Pacific College, and it is immensely frustrating that we have that stigma in Chinese medicine that we use endangered species, and so in our program we do learn about these what we call obsolete products, obsolete substances such as rhino horns, tiger bones. I just want to let people know that in our medicine, like any other medicine, it evolves through the centuries. It's not a static where it's someone carved it in the side of the mountain in China and therefore it's gospel or scripture and then it never changes. That doesn't happen. Like any other medicine, things that work, okay, we keep. Things that don't work, we move beyond. And it's very clear. Our medicine is very, very well documented. And through the centuries, you can see the evolution, what worked and what didn't work. And especially now, since the 1950s in China, they have more or less standardized Chinese medicine. They've established academic institutions to standardize Chinese medicine. And they call it TCM, traditional Chinese medicine. And they set the standards, what we should use, what we need to, okay, those are the things we don't do anymore. Now get back to the endangered species and things like rhino horn, tiger bones, all the stuff that a lot of that was never really a big part of it in traditional Chinese medicine, like I would say mainstream Chinese medicine. Rhino horn is not that commonly used, even back in the day. But it takes a life of its own because how exotic it is, and then because of how illegal it is. And then you see people outside of our medicine are attributing qualities to it that's not even in the literature in the first place. First of all, I would say, as a herbs professor, it's nowhere in mainstream Chinese medicine literature that it's even an aphrodisiac in any way.
No, that doesn't even fit it whatsoever.
It's we know, right? It's not even in that category. But of course, the people who are perpetuating these myths are the people who are doing the illegal activities, and they don't care. So it's not something that is mainstream, but yet because it was used in our medicine at some point. And by the way, of course, in China now, all the Chinese medicine universities in the curriculum, that's not something that they teach it as a matter of history, but not modern therapeutics. We don't use that. It's here in the United States, even more so. We also teach that we don't use it. We use it from a historical standpoint. So all the things that you hear about people stealing rhino horns, poachers in Africa, that is contraband, organized crime, syndicates. That's not the Chinese medicine. People, it's almost folklore. It takes on its life, right? So you and I, let's take rhino horns, for example. In the old days, yes, there were people who use it for very high fevers, right? Like perhaps someone with meningitis, that's something they would use. Who is going to pay all this money for someone to poach rhino for meningitis? No one. So the people who want to perpetuate this trade, this illegal trade, are not going to say, hey, we can use this for high fever. Nobody, it's not valuable. So what do? They make up other stuff. Like, oh, it's an aphrodisiac and all these, which is not even part of our medicine. So I just want to let people know it's not part of our medicine. Tiger bones. In the old days, people may use it for arthritic conditions. Nowadays, we have so many other options. It's no longer taught as such. So now they say, oh, tiger bones can also use as an aphrodisiac. It thinks everything comes down to aphrodisiac.
What?
That's the best seller for everything. And all these, they're not mainstream Chinese medicine at all. I know we're spending a lot of time, but I'm very passionate about letting people know that's not part of our medicine. And
no, it's literally one of the most common questions that I get. And I have people constantly either harassing me on social media or I remember even a couple of years ago, I went on a date with somebody who knew that I was a doctor of Chinese medicine and owned an herb company, my second herb company, and was like, I would never trust Chinese herbs. You never know what they put in there. And I was like, first of all, I own the company. Second of all, I owned a company that filled formulas for practitioners all over the country. Third of all, I have a doctorate in this. Like, I do know what's going in all of this. Incredibly, to the detail, do I know what's going in there? And this is just not something that we do in our medicine anymore. But it's mind-blowing how far that myth has been perpetuated.
Absolutely. And if we have a chance, I know that's one of the topics we can talk about, is how regulated our industry is too.
I would love to go into that. Yeah, that'd be great.
Okay, so one of the myths about Chinese medicine is like the wild, wild west. Anything goes. It's not regulated. So number one, that's not true. The FDA stands for Food and Drug Administration. So herbs are not considered drugs, but they're considered food. So being the FDA has the F in it, and for food, so they actually falls under the jurisdiction. They do regulate that. They regulate raw herbs as food. They regulate capsules, granules, pills. these are processed herbs or processed food. So they call it dietary supplements. So that's also fall under their jurisdiction. So they're regulated. So a lot of you think that, hey, no, they're not regulated. You can input whatever you want. No, there's a standard. The FDA in 2005 came up with this new rule. Has a legislation. They updated the legislation that if you're going to make something, right, if it's whether it's herb, whether it is a dietary supplement, it is required to have documentation that it is what it is, that you have labs to show that it's safe. That includes testing for heavy metals and pesticide. That is required.
Yeah, another common misconception.
Yeah, and by the way, if you grow herbs in the United States, it's not going through customs. You do not need labs. So if you grow herbs, let's just say we're in New York State, upstate New York, you bring it to market, no one checks. But if you're bringing herbs in, you need to have labs. So just let people know, because it's coming from another country, you need labs for sure. So now are there, so this is all, I'm talking about raw herbs, and I'm talking about all forms of stuff. When they're coming into the country, you absolutely, there's a standard that the Food and Drug Administration require, and it's called Good Manufacturer's Practice. And oftentimes you see in the literature, it's called GMP, Good Manufacturer Practice. That's a standard they set up that manufacturers have to follow. So let's quickly talk about many companies in the U.S. When we go and buy and we go acquire dietary supplements, right, from China, we have to find a factory that's registered with the Food and Drug Administration that has GMP certification. So the FDA is aware of them. And the FDA, by the way, have offices in China, because it's not just a Chinese medicine thing. When you go to Rite Aid and you buy, let's just say, ginkgo biloba capsules, it's the same FDA GMP standards from China, like that in those Chinese manufacturers. And that's how we protect ourselves as a country, to maintain that standard. So it's no different from when you go to Walgreens or Rite Aid to buy these supplements. It's the same standards to hold. So people should know that our industry is very much regulated. So it's not like, oh, anything goes. So and people are oftentimes surprised to hear that, because they think that, oh, well, just like, it's like we can just bring in whatever we want. Oh, you cannot. Yeah.
Yeah, it's that's definitely one of the misconceptions I see often is, owning Radical Roots. So it's CBD and Chinese herbs. And I always joke, I don't know whether people are more scared of hemp or whether they're more scared of Chinese herbs having like heavy metals and pesticides, or just sort of like the, whatever misconceptions that people are coming to Chinese herbs with. And I'm like, these are both incredible. And, the research behind every single herb in every one of my formulas is profound. And, that includes hemp as well. So it's always quite tricky. And especially with Radical Roots, one of the reasons I wanted to do this was because, and why I wanted to do the podcast, is with Radical Roots, I can't say anything about anything on my website whatsoever, because we have hemp. I think you had your credit card processor shut down or got in trouble for it because you guys were selling hemp also. I think a lot of people don't know all of the regulations with that. And this podcast is not about CBD, so we won't go too far into it. But it's such a pain. I have a modification of Xiaoyaosan, which is free and easy wonder for anybody listening. It's like one of the most commonly prescribed Chinese herbal formulas for women's health. It's also been heavily researched for its anxiolytic and neuroprotective properties, blah, blah, blah. Fucking amazing formula, right? Super safe for most people. It'd be hard to go wrong with this one. And on my website, I wrote, the base of this formula is a Chinese herbal formula that has been used for hundreds of years to support women's health. And I had my credit card processor hold my money for a month, and I was like, support women's health. Like, that is not even, like, that's literally as vague as I could possibly get. Like, I did not say endometriosis, fertility, like, absolutely nothing. I just said support women's health, and shut me down. So it's, I think the education component about Chinese herbs, letting people really know the power of our medicine, the versatility of it, is just so important. One of the things I'd love to dive into is what are some of the things that you see most commonly clinically or in the pharmacy? Like, what kind of conditions are you seeing people come in with that are really well supported by Chinese medicine? Obviously, we don't treat any Western diagnosis. That's one of our regulations in our field. We treat based on Chinese medicine pattern, as you were saying, but a lot of people come in with Western diagnoses, and just curious what you guys are seeing a lot these days.
I think we may be a bad person to ask about that, only because we get such a varied, we get prescriptions from all over the country, all different types of practitioners. So across the board, pretty much everything under the sun. So it's really hard to answer that question, but I'll tell you some top ones. I would say probably one of our top one is fertility. Helping older women, older as in what traditionally people get pregnant, earlier in their 20s, but women are having them later and later. And as you get older, your fertility rate tends to go down. And something that's one of the strong points of Chinese medicine. We help build up, right, the body so that way can help with conception and also sustain a pregnancy. That's something that's Chinese medicine is very good at, and we oftentimes complement Western medicine approach. So even a lot of reproductive endocrinologists are very receptive of that. It's not competing, it's complementary. So that's a big part. That's one at the top. Another one that we have a lot of is sports medicine. We're very good at sports medicine, particularly the recovery stages of sports medicine. So we see a lot of form because as people get older, or people who are more deficient, the healing process is much slower. And I'll tell you, as a Western pharmacist, if they say, "Hey, what medicine do we have to help people heal better?" I really would be tough to give you a good answer. Maybe you say, "Oh, calcium," but not really. Like in Chinese medicine, it's a no-brainer, right? We would tonify liver and kidney systems, and that would help build strengthens the sinew and bones, the bones and the tendons. Every Chinese medicine practitioner learns that in school. Very straightforward. So we do a lot of that as well. That's one of, and of course, your run-of-the-mill anxiety, colds, tonifying, a lot of tonifying formulations. But I have to say, if you ask me, like, what are the more popular ones where Western medicine is not very good and that we are very good at, those we do see a lot of. I'll give you one. Hormone replacement therapy is out in Western medicine, right? Because it's not something that we really do anymore. But in Chinese medicine, we are very good at that. Control menopausal symptoms and things like that. We get those formulas all the time. Anxiety. And there's another one, what you said about Xiaoyousan. Like a Xiaoyousan modification-based type formulas, we get them all day long. Western medicine, what do we have? We have a lot of good anxiolytics, we have benzodiazepines, things like that. We have Zoloft, whatever, all of these things. But those things have a lot of side effects. And a lot of people want to choose it the natural way, where we actually are balancing the body and we're optimizing the body's ability to rectify itself, which I will always advocate to try first. Because what a lot of people don't know, and I'll tell you as a pharmacist, if you're on Zoloft, you're on it forever. That's just facts. It's not like, oh, let me go on it for 2 weeks. It's a commitment for it, because it's really not addressing the root of the problem. You're addressing it very specifically, chemically, in that pathway, how that works, right? right? It's serotonin reuptake inhibitor, right? So what does it do? Why is the system off? We don't even care in Western medicine. We'll just kind of fix that one little pathway. In Chinese medicine, we balance your body and let your body rectify itself. That should always be first choice in my book, right? Like if family members, whatever, someone who asks, that's what I would tell them. So these are the things that we're very good at in Chinese medicine and Western medicine not good. And those are the type of formulations that we see a lot of.
Yeah, I'm personally of the belief that pretty much every woman should at least see an acupuncturist or a doctor of Chinese medicine a couple of times and see how that goes. I mean, the amount of hormonal issues in our society today with the, endocrine disruptors in the water and in our fabrics and all of the stuff. It's an epidemic, and same with infertility, and Chinese medicine is just mind-blowing when it comes to supporting women's health from teens through menopause, as you said. And I always look at, even just teenagers being put on birth control to regulate their cycles and their emotions. And it's like, just get them on some basic herbs and they'll feel so much better. So that's one thing that I'm always advocating for women.
No, absolutely. It's not like that these things are bad, but that really should, in my book, as a pharmacist, it should be a last option. I would always try to rectify it naturally if I can. Let's try that route first, and then oftentimes you'd be surprised. Many things can be fixed with a combination of balancing the body, diet, exercise. You would be surprised how well. And people may not understand it and they go, oh my God, Chinese medicine is a miracle. No, it's not a miracle. All we do is we optimize your physiology to do its thing. That's all it is.
Yeah. It's really honoring the body and reminding it what it's supposed to do. And one of the things I love about Chinese herbal medicine compared to even Western herbology is that difference in terms of we use herbs together to create dynamic formulas that, as you're saying, are addressing the symptoms, but also the underlying patterns of disharmony so that you're building health over time. And, it really helps you, learn to grow in health as opposed to just the Western mindset where you're, as you said, just hitting this one pathway and not looking at the downstream effects in different ways that always seem to have some surprisingly deleterious effects when the research comes out later on.
Absolutely. One I love, one condition I love to talk about is lower tract, urinary tract infection, right? It's very common in women due to their physiology. That's just the way that the urinary tract of women is very susceptible to infection. So in Western medicine, we're very good at giving you antibiotics, and that would take care of it. But guess what happens? Oftentimes when we give you antibiotics in Western medicine, it basically carpet bombs the flora, the normal flora in your gut, right? And you end up getting a yeast infection because you kill the bad bacteria, but you also kill the good bacteria in addition to the bad bacteria, right? The microorganisms. And that really is not good. And then people end up getting yeast infections. And oftentimes it will come back and it come back. In Chinese medicine, what we do is we help address the pattern, which is DMP oftentimes, and we allow the physiology to rectify itself. This should always be tried first because it doesn't upset the normal flora. And we know, and I'm sure a lot of your listeners who are female probably know this, that how many times they have UTI and they get over and take antibiotics over and over again. It's like a vicious cycle. And that's why there's antibiotic resistance in our in this country, overuse of antibiotics. So something that I would say is a strong point in Chinese medicine. That's one example of.
Yeah, I had one patient who had UTI, yeast infection, I think 30 times before she came to see me a couple years ago. And I was just like, okay. And nobody stopped this cycle in any way, shape, or form. So we're just going to look at this now. So we're running lower on time, but there are a couple of things I still would love to pick your brain about. So one, obviously, colds and flus have been on people's minds these past couple of years. I think Chinese herbal medicine is pretty damn phenomenal at treating colds and flus. What are there any herbal formulas that you recommend that families might have on hand, like even something like cold quell or yin chow, just some of the basics and maybe a little bit of a description about like when you might want to take those formulas and when, a pattern might, or, a presentation of somebody's cold or flu might be something that they really want to go and see a practitioner for, how we sort of address acute situations like that in Chinese medicine.
Yeah, so cold and flus are oftentimes viral. What do we have for viral in Western medicine? Not really anything. I mean, I think they have the new one now, that it's antiviral, but you have to take it within the first, I forgot how many hours, like maybe 72 hours. The rest is too late. And then even if you were to take it, it only shorten the presentation, like your recovery time's a little bit quicker. Oftentimes people miss that window, just so you know. And it's not that effective. And this is just in the literature, that's what it is. In Chinese medicine, what we do, one of the strengths that we have is two angles. One is strengthening your body beforehand. During COVID, not everyone presents with the same severity, right, when they contract the virus. And why is that? And it's a multitude of reasons from a Western medicine standpoint. But from a Chinese medicine standpoint, it's just that our qi, our energy, our wei qi, our protective qi is stronger. And we can actually address that in Chinese medicine. For those who oftentimes many times get sick during the flu season and whatnot, that's something before the flu season, we will build up the body with a formula. Jade windscreen, that's a very common formula, right? Many companies make a variation of that. So I would advise people to build that up before, not during, before. That's one thing. But once they have a cold, but like a variation of yin chow, many companies make it. You mentioned the name Copewell is one of the names you mentioned. Many companies make a variation of the yin chow formula, which is also good. But of course, I would say consult with a practitioner to make sure that's the right formulation for you. Those things that we can do, and it would help shorten your symptoms, or in the first case, when you strengthen the body, you will have maybe very minimal symptoms or no symptoms, right? Because we know just because the virus is present within you doesn't necessarily manifest clinically the same way. So that's something to keep in mind. How you treat yourself is important. Your constitution matters, and the presence of viruses helps.
Yeah, I think there's just such a wisdom to our medicine, and I thought that COVID was such a beautiful example of how we look at patterns in Chinese medicine, because everybody was presenting differently. Some people had dry cough, some people had really phlegmy cough, some people had no cough, some people had no symptoms whatsoever. Some people had, sort of more of the steaming bones, wasting, sort of exhaustion. And that's really the strength of our medicine, is that we're able to assess both the person, their health, and the strength of the pathogen that's sort of attacking the body, and support them. And obviously, again, we can't say we treat any of these things, but, I think it's a very good idea to have a Chinese medicine practitioner on hand if you are sick. And it's something that we do treat very, very well. Chinese herbal medicine, I think we have just classically, at least 40 different classical Chinese herbal formulas for colds and flus. So we can get very specific on exactly what we're doing. And then obviously in Chinese medicine, I guess we didn't even get into this, but a lot of practitioners will customize formulas specifically for the patient. So you're really getting customizable pharmaceuticals. So if you have a severe cold or flu, it is a really powerful way to go. And I'm sure you guys were right in the thick of it there in China.
We're super duper busy during that period. Yeah, for sure.
What would sort of be your dream in terms of where Chinese medicine goes in the States? Like, what would you like to see happen? More research or more inclusivity into Western medical systems?
One day, Chinese medicine would be just called medicine. And so it will be Chinese medicine is like a branch of there's Western medicine, Chinese medicine. It would just be medicine. And I think that we would and that it would be ideal that people would choose the best option depending on the presentation. And there will be no hesitation with them. Because I think that the more educated you are about pathophysiology and the management of these diseases, you realize that each medicine can benefit with the presence of the other. Why are we choosing one and not the other? Like, it should be, we should have the full range of options for our patients, right? And it'll be my dream one day that in medical school, they will be using Chinese medicine and Western medicine as an option. It may take a few generations of people, maybe. So we'll see.
I love that. For me, just one of the things that I'd like to add is I think, as a practitioner, I just want to honor you and the work that you and your crew do over at CAMWO. I am very passionate about the belief that nobody will, that as a field, we will not reach your vision of being a more inclusive and included medicine unless we as practitioners get out there and actively educate the public on our medicine and what we're doing, what we're capable of. So really, it's truly such an honor to get to speak with you today and to watch you guys and all the incredible work that you've done over the past 50 years.
Thank you for the kind words, and the same I could be said for you. You're out here doing this and spreading the good news about Chinese medicine and the role that we play, and that it is important for us to get out there and let people know.
Awesome. Well, thank you so much, and I will talk to you soon.
Thank you for listening to the Radical Remedy Podcast. The Radical Remedy Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor/patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.